Hello, and welcome to Grade.com Talks With. Today, we're talking with Dr. Neil Barnard, President of Physicians Community for Responsible Medicine, an organization that is dedicated to saving and improving human and animal lives through plant-based diets and ethical and effective scientific research. And if you're new to our podcast, please press subscribe button either on YouTube or your podcast app, because today we're going to learn about an organization that is creating a healthier world through a new emphasis on plant-based nutrition and scientific research conducted ethically without using animals. Hello, Dr. Neil Barnard. Welcome to Grade.com Talks. We're excited to have you here.
Hello, thank you. It's great to be here.
Wonderful. Could you please tell us what does Physicians Community for Responsible Medicine does for people who are not familiar with your work?
Yeah, the Physicians Committee for Responsible Medicine got started in 1985. We're a nonprofit charity, and we promote ways of doing research that don't involve animals. And we do this for two reasons. One is because it's obviously kinder to animals to leave them out of experiments, and also it advances research in ways that are not possible by studying rats and mice and cats and dogs. But apart from that, we also have a heart for animals in another way, and that is we're busily getting them off the plate. And as physicians, for a long time, we've realized that when we shift to a healthier diet, vegetables, fruits, whole grains, and beans, it's not only better for all the animals that we're not eating, but it's good for your coronary arteries too. So as physicians, we use our expertise to improve research and to improve people's diets.
Wonderful. And the fact that you mentioned that you are working was in terms of taking animals out of the humans' plates, as well as your focus on banning on using ethical scientific research rather than using animals for the purposes that are not ethically and environmentally friendly. So it's wonderful to see that you're working on protecting animals' lives as well as improving human lives while you're doing that in the process. You mentioned one of your focus is good nutrition and you advocate for plant-based diets. Could you please tell us why plant-based diets are important and their benefits for humans, animals, and environment in general?
We found that when people break away from the meaty diets that many of us grew up with, including me, when we break away, we do find that people are able to lose excess weight. They're able to cut their cancer risk. They're able to reduce their risk of heart problems and other things. But more than that, many people have problems right now. They need to lose weight now, and this is a way to do it, or they've got worse problems. They might have type 2 diabetes or inflammatory problems like rheumatoid arthritis or multiple sclerosis. They might be suffering with menopausal symptoms that are driving them crazy and ruining their quality of life. In all of these areas, the role of nutrition is sometimes a surprise to people. But we put it to the test with good research studies. We publish a lot of scientific articles, and we make educational tools that allow people to adopt this kind of diet. We also are very eager to bring healthy diets to people who need them the most. Here in the United States, we see some really quite vicious disparities where some racial groups have much higher rates of diabetes and certain forms of cancer than others. And sometimes that's because of not very good access to healthy foods, or not good access to good information about healthy foods, and not good maybe economic situation and good access to medical care. We do what we can to change those things. We have programs reaching out to economically disadvantaged populations, and we also have a number of educational programs for people of color, for Spanish speakers, for Native Americans, and we have international programs as well. China and India are two countries, the biggest two countries in the world, where we are seeing a huge process of westernization, where traditional healthy diets are being paved over by American fast food and all of its kind of similar kinds of unhealthy eating. And the result of that is diabetes and heart disease and cancer. We have programs in both of these countries to reverse those trends as well.
Mhm. Wow, the wide and range of the programs that you are running in terms of advocating for the plant-based dieting and educating the public in general is very broad, and you are taking initiatives in many directions, both in terms of supporting minority groups who don't have as much access to healthier diets, and also focusing the shift on the countries that are seeing the effects of the globalization in terms of a negative way rather than the positive way. And you are educating and bringing attention to those problems and bringing solutions as well. And that's very important to see that. You mentioned that for people who have grown up eating meat-based diets, your organization does research and has made progress and has made educational programs in terms of how to adjust to plant-based dieting. Could you please tell us for individuals who are interested to shifting to the plant-based dieting, how to adjust from how to make a shift?
Yes. The first step is to think through why would we want to make a shift like that? Mm-hmm. And when people learn that diabetes can sometimes actually improve so much that you can reduce your medicines, maybe even get off them, maybe the disease will even disappear for all intents and purposes, or hot flashes can be gone, or excess weight that's been sticking around chronically, that can go away too. Arteries that have been narrowed can reopen. So the payoff is huge. And then the next step is to actually make the change. And we have a way that we help individuals do it. We have research studies that have put this to the test, and we also have a primary care nonprofit medical center where patients come in and we change their diets, and that gives us a chance to see what works. And what works is a two-step process. Number one, we ask people to take about a week and to think through the foods they might eat if they were not eating animal products. And so we ask them to fill out a piece of paper and jot down their ideas of things for breakfast and lunch and dinner. And we'll give them lots of suggestions. And after a week, they'll usually have a pretty good list of things that they could eat, whether they're at a restaurant or at home, or maybe even at a fast food. And then the next step is, once they've thought through their list, okay, I guess spaghetti with tomato sauce instead of meat sauce, that would work. I guess instead of a meat chili, I could have the bean chili. Instead of the meat taco, I could have a bean burrito. And instead of fish sushi, I could have the cucumber roll or the sweet potato roll. They've got a list. After they've got that together, the next step is to actually try a plant-based diet for 3 weeks, 21 days. And at that point, our patients will say, well, that's easy. I could do anything for 21 days. And I've already got my list. In fact, I stocked up on the foods. They try it, and they may be skeptical going into it, but they soon discover two things happen. One is physically they are healthier. They lose weight, their diabetes gets better, their energy is better, their digestion is better, their skin starts to look better, but also their attitudes change. They start to discover that food is their friend. They enjoy the new taste they're discovering. They don't really miss the unhealthy foods they're getting away from. And at that point, staying on a healthy diet permanently is a great prospect for them. We also have some specific tools. We have an app that is called the 21-Day Vegan Kickstart. It's available online. We made it for our clinicians, but anybody can download it. 21-Day Vegan Kickstart. It's available in Spanish and English. And at our website, PCRM.org, we have quite a wide range of resources, all of which are free of charge.
Wonderful. I really like the tactic of, as you mentioned, for 1 week to seeing what kind of change they can make in their diets and what kind of substitutes they can see in terms of the plant versus meat, and then try it, although skeptically, for the 3 weeks, but in the journey, in the process, discover the benefits of it, discover the changes in the attitude, the changes in the health, the changes in the skin and everything. And then by testing, by seeing it, you an individual realizes the benefits of it. And once after 21 days, it takes, they usually say it takes 21 days to build a habit. So then with this trial period, actually people can build a habit and make a shift towards better health, towards better world in general. So that's wonderful to see that you're providing both in terms of digitally and also educating general public on that. We all know that 2020 has been a challenging year as well for you physicians and the researchers. It has been a very tough year as well. And this COVID taking in place, you fought for the ban of live animal markets across the globe. Could you please describe your work in this area for us?
Yeah, well, there are several things that have to happen. The pandemics very often are the result of an infectious agent passing from animals into people. And this is not a new bit of knowledge. There's what was called the Spanish flu of 1918. It actually was an influenza virus in birds that passed into humans. And the flu that goes around every winter is actually a virus that started in bird populations way back when, and now we're stuck with it. Coronaviruses live in other animals. Bats are best known for it, but they live in other animals too. And with live animal markets, there's the opportunity for close proximity of animals to mean that viruses jump from one species to another. When they do that, they become more transmissible, meaning they can go from one to another more easily, and they can become more dangerous. That's what we've been seeing with the coronavirus. And so now we have not just the alpha variant that started it all, but we have many other variants, including the current Delta variant, which is really extremely transmissible. So we need to shut these things down. And not just in China, but here in the United States and everywhere else. It's a tough call because commercial pressures keep them open, but we're working to change that. But I might say one other thing. The pandemic taught us something else. It taught us that a disease-causing virus is not really very democratic. If it reaches somebody who's young and healthy and thin, 23 years old, they're probably going to do fine with it. They may cough and not feel so good, but they'll cast it off. But if you've got diabetes, especially out of control diabetes, we used to say diabetes could kill you over several decades. Well, now if that virus comes in your front door and you've got diabetes, you could be dead in 14 days because diabetes is an underlying condition that makes viruses more deadly. That's also true for hypertension. It's true for chronic lung disease. It's even true for obesity. People who are seriously obese are often end up on ventilators or they die when they get COVID. So a big part of our work has to do with spreading the message to communities at risk. So when the pandemic arrived, instead of just doing talks at libraries and here in our office, we decided to power up Zoom as aggressively as we could and do as many classes as we could to underserved communities, not just here, but also overseas. And that process is continuing to this day.
I applaud your organization for being very flexible and for being in front line educating people about the dangers, about how to deal with pre-existing conditions and the communities that are in risk through Zoom and through other educational resources available. So I very much applaud you and thank you for doing this very meaningful and impactful work in the times of need, both in the United States as well as in the world in general. So.
Thank you.
And a second area of your focus is ethical science, and you are advocating for protecting animals and have made quite a progress in 2020, including ban on animal use on surgery training. Could you please share with us some of the most recent results that your organization working with different physicians and different communities has been able to achieve in terms of ethical science in the recent years?
The progress has been huge. Back when I was a medical student at the George Washington University, almost every medical student was required to experiment on dogs and kill them in the course of a laboratory. These labs were not necessary. I refused to participate in them myself as a student, and I decided I wanted to get rid of them for all medical students so that we could hold our head up when we learn how to become a doctor. This doesn't mean that science education is an easy thing, but it means it has to be done right. It has to be done ethically. It has to be done without killing anyone. So as of 2016, we managed to eliminate all use of animals in all medical schools in the United States and Canada. And thereafter, we eliminated them in pediatrics training, in trauma training, except for one. There's still one medical center where they use animals to teach trauma training. Most emergency medicine ones are finished. Most surgery training residencies do not use animals either, but there are still some left. So we've made a lot of progress. Our current target now is emergency medicine and surgery, and also veterinary medicine. As of this week, we have 2 new victories in veterinary medicine, where young veterinarians in training who have wanted to be helpers and not killers, they're happy to know that at Tuskegee University and also Auburn University, 2 big vet schools, have decided that they will eliminate these artificial labs where you take a dog and you experiment on him, do surgery that the dogs don't need, keep them alive and only to operate on them again, and then finally kill them. We've eliminated that so that veterinary students can be healers instead of herders. There's a lot more work to be done there, but we've been very effective, and it's really because of teamwork with our members.
Yeah, you mentioned that the progress that has been made over the past few decades is huge, but there's still some areas and that need work, and your organization is making that progress as progressive as possible, working together with the different teams. So that's wonderful to see that progress, and hoping for more advances, hoping for less cruelty, and hoping for more ethical science in general. And besides using animals in a surgery training, you've also advocated for the closure of slaughtery houses, as well as the stop using animals in cosmetic and different industries. Could you please tell us about your work in that area as well?
Yes, well, the public doesn't like the idea of animals being used to test a cosmetic or a shampoo or a floor cleaner. And there are good ways to assess the safety of these things. So we were able to pass a law in the state of California that cosmetic products cannot be tested on animals, or if they are tested, they cannot be sold in that state. And as soon as that law passed, that meant that any company that made cosmetic products, if they tested them on animals, they would lose the entire California market, which is about 1/5 of the United States market. So that basically meant you're not going to be able to test anymore if you want to stay in business. That was very effective. Other states have then adopted the same ban, but it's really changing things dramatically. The Environmental Protection Agency has required animal testing for various industrial chemicals, and there are better ways to test those too. And I'm happy to tell you that as of 2019, we were able to convince the Environmental Protection Agency to pass a new policy that it will phase out all mammalian tests of all kinds. Now, they're taking about more than 10 years to get it done, but they've vowed to complete that process. So that at least is progress in the right direction.
Wonderful indeed. Although there are some practices left, but yet it's going to do the right direction with the work of your organization and with the advocacy that you are doing and collaboration with Environmental Protection Agency and FDAs and other governmental institutions in general. And as we've talked about what progress has been made, and what are some issues that were solved, and the benefits of the plant-based dieting, how do you see the shift in these 2 focus areas that you are working in the upcoming 5 to 10 years?
I think a couple of things have to happen. The first is we do need more research. We do research studies here, and we were well known for helping people with diabetes to change their diets. And then our job is to study how effective a diet can be. What's the benefit of a vegan diet versus a Mediterranean diet versus a low-calorie diet? We put them to the test. We publish the results. We need that kind of information so that doctors know what they're doing. But beyond that, we need research on other applications. What about diabetes that starts in children? Type 1 diabetes. Would they be helped by being on a healthier diet? They can't stop their insulin, but could they perhaps need less? What about chronic pains like rheumatoid arthritis or migraine headaches? All of these things are things where we put the diseases under the microscope, and we're working very hard to get the results that people need. But once you find results, that's not enough. If you find a diet that works, you've got to get the word out. And so we recently found a terrific diet change that knocks out hot flashes for women in menopause. The hot flashes are keeping them up at night, making them miserable during the day. And we found that a plant-based diet that was very low in fat and that included a small amount of soybeans every day with their isoflavones could knock out troublesome hot flashes in 84% of cases. And that was a huge breakthrough. And so our job now is to get the word out. So it's doing the research and coupling it with educational programs to let people know.
Mhm. Yeah, absolutely. The research is important, but also it's very important to educate and increase the awareness on the results of those research that is being done. So the results and the suggestions can be implemented for the better diet as well as for better sustainable diet, sustainable health in general, and sustainable world. So that's wonderful to see that the key focus is always on educating. So the more people are aware, the less likely they are to harm themselves, and the more likely they are to use the substitutes, to use diets that are healthy for them, so they can be as happy as possible for as long period of time as possible. If someone
Everything that we try to do is sort of a win-win, where we're trying to help people so that their health improves. And at the same time, if animals benefit or the environment benefits because it's a more plant-based diet, that's good too. And that's important because sometimes if a person is making a diet change just to feel healthier, they might cheat a little bit here and there. But if they know that their diet change doesn't just help themselves, but it can help the environment, it can help animals, it can even help their children to the extent that they're a good role model, they're less likely to want to cheat. And that means everybody wins. So a win-win philosophy is what we always try to use.
Absolutely. The best was both worlds. When there is more value, when there is more meaning put into the action, the more benefits, the more sustainable that shift will be. So I really love the strategy and win-win solution that you're working towards it. If someone would like to support physicians community for responsible medicine PCRM, how can they do so?
Well, thank you for asking about that. Our work is always entirely funded by charitable donations. Our website, PCRM.org, gives information on how to donate. And I want to say that I'm a donor too. I don't get any salary. I've been running this organization now for quite a few years, but I'm a volunteer and a donor as well. And I hope people will join me in supporting this vital work.
Wonderful. The link to the PCRM.org Physicians Community for Responsible Medicine's website will be provided in the description. So you viewing and listening can go to the website and familiarize yourselves with the wonderful work Dr. Neil Barnard and the team at PCRM is doing. Thank you so much, Dr. Neil Barnard. It was wonderful to get to know you and the very meaningful and impactful work that your organization is doing.
Great. Well, thank you so much.
For you listening, if you enjoyed this conversation, please press like and share button because this will show the YouTube and podcast algorithm that this conversation is important, that we need to save and improve human and animal lives through plant-based dieting and ethical and effective scientific research. Thank you and see you in the next episode.